A market in healthcare is often thought to damage health outcomes for patients and the working environment for professionals. And the reason often given for this is that markets necessarily introduce unworthy motives and immoral incentives into healthcare. But is this so? That's a question which the Oxford Healthcare Values Partnership has been pursuing in this project, Markets and Meaning, generously funded by the British Academy. We've been working collaboratively, bringing together colleagues in healthcare, policymakers, professionals, those who are in charge of trusts and institutions, with academic researchers, especially early career researchers in fields such as philosophy, law, theology, psychology and business. And the kind of questions we've been looking at is whether it's a wise way at all to think about healthcare, to construe it through the market. Do market processes necessarily demoralise? And especially, what impact do market forces have on the political meaningfulness of healthcare for patients, professionals and policymakers? In my own contribution to the conference at the Royal Society of Medicine, I focused on what I take to be at the very soul of healthcare, and that is the spirit of service. By soul, I mean the life orientation and life force of healthcare professionals. And I take service to be right at the core of that force, that orientation that people take into healthcare. But service can't just be about good intentions, it has to be about effective outcomes too. And so there's the question, how do we so organise healthcare as to ensure good value, effective outcomes, without doing damage to that spirit of service upon which healthcare depends? The kind of areas I looked at were, what are wise ways to think about the incentivisation of healthcare professionals in terms of their performance, and especially in terms of commissioning. What's the right mix or wise mix of public and private provision which can actually enhance patient experience and place-based public benefit? I explored those questions through thinking about trust, solidarity, self-love, temptation and themes of that sort. And also various practical case studies. You can see the full talk on the partnership website alongside contributions from others who participated in the project. So we're very grateful to the British Academy for their support of this project, and into the future the Oxford Healthcare Values Partnership will continue to pursue the common good by taking forward these questions.